All right. Well, welcome everyone that's coming into the room today. It's good to see some new faces in here. Welcome to our live Q&A. We have an awesome guest lined up for today with a lot of just great information about the program that he's going to be talking about. So anyone that's joining us today that hasn't joined us in the past, so my name is Wes Van Epps with Wisconsin Voices for Recovery. I'm also joined here by a couple of my coworkers that are in the room. So we've been hosting these live Q&As, since I think the beginning of April this year. Just having individuals that are in recovery, advocates of recovery across the state and the nation, just to bring information to individuals that tune in live, and then also those that go back and watch our recordings. So just a great time to be connected, for us transitioning and everybody here transitioning to the world of virtual connections. This is just a great opportunity that for those to have just on information about recovery and how to stay connected with one another. So anyone that's joining, if you have any questions throughout the live Q&A here, feel free to put them in the chat. You can also, we'll have some time at the end too that will open up for those that have any questions for our guests today. So yeah, we're super excited to bring on our guest. I'm just going to do an introduction here of him, and then we'll get going. So today we're actually joined by Captain Joe Ballas. So in January, Captain Joe Ballas retired from the city of Madison, Wisconsin Police Department after completing a 30-plus year career. So Captain Ballas earned a bachelor's degree in criminal justice from the University of Wisconsin-Platteville and a master's degree in public affairs from La Follette Institute of Public Police and the University of Wisconsin-Madison. So Captain Ballas is also a graduate of the prestigious FBI National Academy. Captain Ballas served in a variety of operational and support roles during his years of service with the Madison Police Department. In his last 7 years with MPD, he served as a commander for the MPD's South Police District, overseeing 50-plus officers, detectives, supervisors, and command staff. The MPD's South District is located in one of the most demographical, diverse areas in Madison. It has a reputation of being one of MPD's police districts with the strongest connection to the community and neighborhoods throughout the district. So I'm going to bring on Captain Ballas now. So welcome, Joe, and we appreciate you coming on today. I know that with the amazing topic of the MARI program, I know that there's some new things happening with it. I know it's been here for a while now, and you've been a huge part in that program. So like I said, I'm going to bring you on. Why don't you just talk a little bit about first yourself, whatever you want to discuss about your career and what led you into helping with this program.
You bet. Thank you, Wes. Appreciate it. And thanks, folks, for joining this afternoon, or those who are later watching this online. As Wes said, I retired in January 2016, about 4 years ago, from the Madison Police Department. But when I retired, it was never really my intention to retire. I've been very busy and involved in a variety of different consulting projects, ranging from some work I did out in Seattle. I'm currently working on a project in Roanoke, Virginia, and even helping this Madison School District out for 3 years, coordinate safety and security for them. So I've been pretty busy, but one of the things I was very proud and honored to be representing is the city of Madison and the Madison Police Department specifically. In the February 2017, January-ish that year, I was contacted by MPD, and they are looking for someone to help coordinate a new grant that they had just received from the federal government for $750,000 called MARI, the Madison Addiction Recovery Initiative. And I'm going to tell you a little bit of story today, and I got a slide deck to kind of bang through to help tell this story. And I'm going to make this available to anybody that's listening today so that you can see this yourself. Some of the slides I'm going to run through pretty quickly. But to start my story and try to keep on task here, I'm going to share my screen. And Wes, you tell me if you guys are seeing that.
Yep, perfect.
Okay, boom, bingo, there we go. All right, so how did MARI start? These three infamous people conspired, collaborated, whatever they did in about 2015, we believe it was, at the WISM conference, Wisconsin Society for Addiction Medicine. where Captain Corey Nelson and Jason Friedman had both completed lieutenant assignments recently then in the Dane County Narcotics and Gang Task Force, and they started to see the influence of fentanyl in our heroin supply coming into Dane County. And they went to the WISM conference to learn more about addiction, and there they met Dr. Alexandra Zagurska. And through that collaboration, the three of them, they wrote a concept piece that was submitted to the United States Department of Justice that eventually in October 2016 turned into a $750,000 federal grant to fund the MARI program. Once the grant came through in October of 2016, MPD does, as it always does in its strong community policing fashion, started to pull others into the table. And some of those other collaborators, besides Dr. Zagurska and the UW Department of Family Medicine and Community Health, but also Dane County Public Health, Dane County Human Services. Later on, I became involved, as I said, in the spring of 2017, and I actually brought Cheryl Whitkey and Safe Communities organization as part of that, and we provide the project coordination services for the MARI project. And last but not least, eventually a contract was signed in the summer of 2017 with Connections Counseling here on the west side of Madison that served as our assessment hub for the MARI program. Just some quick, I'm sure I'm preaching in the choir to a lot of you here, but before the pandemic that we're all living through right now, we had an epidemic around addiction and opioids, and that's still as prevalent today as it was before the pandemic, not more so. This is a quick graph showing the last 20 years in opioid-related deaths in Wisconsin, right from the Wisconsin Department of Health and Human Services. Last year, there was, it's not represented on the chart, but 916 opioid-related deaths in 2019, an all-time high. This is looking at opioid data by month. I'm sure a lot of you probably have seen this, but you can see particularly in 2019 and now into 2020, how we're well above our monthly average for the last 5 years. In Dane County specifically, we also track our opioid-related deaths and overdose incidents. 2019, we had 105 opioid-related deaths, and that was an all-time high. And then this chart here represents quarterly overdose response data by just the Madison Police Department. There's 20 plus law enforcement agencies in Dane County, but this data here just represents the Madison Police Department, and it's data that we track. But we actually were kind of going down below our trend line at the beginning of this year, but when COVID hit, we've now seen steadily every quarter an increase, and looks like we have another increase because Q3 is ending today. This is opioid-related fatalities over the last 4 years since we started MARI, and for the first 8 months of this year, we've already had 27 opioid-related fatalities, and unfortunately are probably on track to get close to 40 again this year. We started MARI, and I'll tell you more about specifically MARI in a second here, but in September 2017, but since we started MARI, we've actually 6 of our MARI participants or referrals were actually an overdose fatality as well. So it's hit close to home for our MARI program. This is just another way I wanted to show people how we look at overdose data. And this is every year we take this Madison Police Department overdose data and we plot it. We create this heat map. But if you're familiar with Madison, you can see it, kind of see the Capitol downtown here. See East Washington Avenue, the Easttown Mall area, a little bit in the John Nolan Drive area, or Park Street, I should say, and then out here in the southwest side of Madison where I live. The big thing and takeaway I want to share with people that this is very consistent, but just about 55 to 60% of all overdose calls occur in a public location. I'll say that again, about 55 to 60% of all Madison overdose calls occur in a public location. About 4 out of 10 actually occur at a residence. And this data here is something that came out of Dane County Public Health and Dane County Emergency Management this summer. But what this shows is EMS data for Dane County, where they're making EMS runs and where Narcan or naloxone is administered. And the big thing, and then Sarah Johnson from Public Health was quick to point out this spring how we started to see trend lines for EMS calls in Dane County well above the more than 5 or 6 happening a day, which was we believe that was related back to the onset of COVID. Another little statistic I like to put out there too, but we're well aware in our data that there's a strong disparity with respect to African American. Proportionally, they're 2 times higher mortality and overdose rates compared to whites and Hispanics. So what is MARI? MARI is a pre-arrest diversion program. It's similar to district attorney office-led diversion efforts, or even drug court, where basically we're trying not to deeply involve the criminal justice system. And in fact, what we're trying to do at the police department level is we're trying not to arrest anyone at all. And I'll explain in a second here about how that exactly happens. But it's based upon other initiatives that Corey Nelson, Jason Friedman, others saw out in Gloucester, Massachusetts, the Seattle LEAD program. We're not unique, but we do think we're a little unique in terms of how strong of emphasis we're doing at the police department level on pre-arrest diversion. MARI offenders are referred by law enforcement to the MARI Assessment Hub for formal clinical assessment of their addiction and provided a treatment plan. The grant that we receive from the federal government pays for the assessment, okay? And but it does not pay for treatment. But that's important that we have the involvement of Dane County Human Services, because after that assessment happens, a team of people sit down, and when they put together that treatment plan, they figure out where that person's at financially, insurance-wise, and we figure out what the best programs we have available here in Dane County to connect them with. Once a MARI offender receives a treatment plan and they remain compliant with their treatment plan, we deem that a success if they complete 6 months compliance with their treatment plan. At that point, we have a letter from the police chief, or if it's a Dane County Sheriff case, because they came on here in the last year or two, they receive a letter from Sheriff Mahoney or Chief Wall that congratulates them on their first 6 months being compliant with their MARI treatment plan, and that we are avoiding all charges associated with their initial contact they had 6 months earlier with the Madison Police Department. This is just a quick kind of schematic of how it works. You can see this is the law enforcement. We have the assessment here in the middle. Another big part of assessment, when that happens, as soon as that assessment happens, they walk into our MARI coordinator at Connections Counseling, who has been Kim Hurd, and we've had the same person for 3 years. She's been fantastic. And we also have a team of 5 or 6 recovery coaches that work for Kim, and the MARI participant is immediately assigned a recovery coach, and oftentimes that recovery coach is there to meet them after assessment, and they begin that relationship. Huge part of our program in terms of the recovery coaches and peer support specialists. Again, getting them connected to some type of treatment here in Dane County for their addiction, and again, completing it 6 months, no criminal charges. This is just a copy of a citation that we give them in addition to a form I'm going to show you here in a second. This is a Wisconsin Uniform Misdemeanor citation. The majority of referrals from the Madison Police Department have been from overdose scenes. Even though I'm going to show you in a second, there's some other low-level offenses that we also allowed officers to make referrals for if the criminality was associated with addiction. But I can tell you, 3 years into this now, the majority of our referrals have come from overdose scenes. Dane County Sheriff's Department, they use, if you ever gotten a speeding ticket in Wisconsin, this is the standard track citation that the State Patrol, everybody else gives out. The Sheriff's Department would fill this out and give that to the MARI participant. And again, they get this, but it's not submitted to court. There's nothing on CCAP. This is all held in abeyance at the law enforcement level. And once they complete, all of this stuff is voided. It's forgot about. This is the actual 3-part or 2-part form that the officers fill out. I'm going to get some graphics here to kind of go into, I want to go into this segment right here. And this is what the MARI participants saying. So I'm going to walk you through a typical scenario. We get a call to the Burger King at Park Street and Badger Road, the south side of Madison, with an overdose victim. The officer gets there with fire rescue, Narcan's administered, they're driven up to Park Street to Meriter Hospital. The officer goes in there, has a conversation with them, as they're recovering from their Narcan and getting ready to be discharged. The officer writes them a misdemeanor citation for possession of heroin if there's probable cause to believe that it was heroin, and usually there's a needle or some other paraphernalia that's there at the scene where the probable cause believes that they were in violation of state law. But they also say, listen, you are eligible for this new program that we've had in place for a couple of years now called MARI. And this is what they talk to them about, is that I, the undersigned, understand I've been contacted by the Madison Police Department for a violation of state law. I agree right now to be referred to the MARI program in order to enter treatment. I agree to go meet with the program addiction counselor. As part of this referral, I understand my participation in the MARI program. The Madison Police Department will not refer my current offense to prosecuting agencies at this time. And a prosecuting agency would be the district attorney's office or the city attorney's office. We tell them we're keeping that at the police department. We're not sending this anywhere else. We're giving you a chance to work with us here. If I successfully complete the 6-month program, commit no further offenses, the current offense will be disregarded permanently. I understand I do not successfully complete the program, the Madison Police Department will refer the original charges to the district attorney's office or city attorney's office for prosecution. This is a flow chart that's on the back of one of those forms that the officers use, because we've got some eligibility criteria associated with this. Again, the eligible offenses: possession of controlled substance, possession of drug paraphernalia, but also we also have some others. If a burglary or theft of a family member is involved, and we know that a lot of families are victimized by their loved ones that are suffering from addiction. Retail theft incidents, theft from auto, prostitution. These are all types of things that when we were building MARI, that we were aware that they were the types of crimes that officers and later detectives would end up investigating. But as we get into it deeper, we realize addiction is the cause of the criminality here. Let's take a timeout. We're not going to refer any charges, but let's take and see whether or not the suspect here or offender may be willing to participate in the MARI program. The things that would make someone not eligible are some of these in this box. Any incidents that we, Madison Police, are aware of in the last 3 years are on homicide, sexual assault, battery, stalking, carrying a concealed weapon, robbery, reckless endangering safety, domestic abuse, strangulation, suffocation. Again, the big reason why this all came out was because of our concern about the recovery coaches and the staff at Connections Counseling. And we wanted to make sure that we had, we've got a program that we believe works well for low and moderate risk people, but if people are deep and involved in the criminal justice system, MARI is probably not for them. I'm gonna pause there. Once they get to Connections Counseling, this is the release of information form. There's a number of forms that they sign as they go through their intake and then later assessment, but they specifically give consent back to and release information from their treatment to the Madison Police Department, to Safe Communities, that's myself, and Dane County Human Services. And what we've been doing, and I, as part of, I work very closely with Dr. Zagurska, and I'm going to share with you in a little bit some preliminary information we've got from the evaluation we've done of those who have participated in the MARI program based upon the UW's analysis of the data we've been able to collect from MARI participants. This is just a simple slide that kind of goes over our overall MARI implementation. A big piece here I'd just like to talk about was in the spring of 2017, and we went live with MARI on September 1, 2017, but we did all MPD officers received a 2-hour in-service that focused 1 hour on addiction, usually having somebody living in recovery, coming in and talking to officers firsthand about their experience living with addiction. And then the second hour was just over an overview of the MARI program for officers and some training around the forms, et cetera. Let's get to some results here. The MARI 1.0 officially ended August 31st. As of the first of this month, we transitioned from the first 3-year MARI 1.0 program to a new grant that the City of Madison and the MPD just received for $1.2 million under the COSAP grant that some of you may be familiar with, that's out there right now. So MARI 2.0 is now under a Pathways to Recovery model, is now being implemented, being coordinated by Dane County Public Health in collaboration with the Madison Police Department, Dane County Sheriff's Department, and an expansion of MARI to any other interested community in Dane County. But in MARI 1.0, I can tell you that in the 3 years, we had over 300 referrals made by Madison police officers and Dane County Sheriff's deputies to the MARI program. 20 actually came from the Sheriff's Department. In that mix of 300, there was 24 duplicate or multiple referrals for the same person. 73 referrals were reviewed by MPD and determined not to be eligible. There's an MPD MARI coordinator that's been Detective Dan Swanson, or now Officer Bernie Albright. They, for whatever reason, when they looked at the person before they sent it to Connections, deemed them not to be eligible for the program. Ultimately, we had 264 individuals that were sent to assessment at Connections Counseling. 164 of them actually contacted at Connections, went through assessment, were assigned a recovery coach, and received a treatment plan. 91 MARI offenders have successfully completed 6 months compliant with their treatment plan, and 13 are currently participating in their MARI program and compliant with their treatment plan. There were 60 offenders that went through assessment that were later discharged unsuccessful for falling out of compliance with their treatment plan, or they just simply became disengaged. And there was 100 MARI offenders out of that 264 that simply did not call or when contacted by Connections about coming in for an assessment, they changed their minds and decided not to participate. Consequently, those individuals had their charges referred to the district attorney or the city attorney's office. This chart here just kind of illustrates our success that we believe we're batting almost 2 out of 3 of the 264 actually made contact with Connections Counseling. We feel that's pretty good, 63%. And on this chart here, out of that 164 that actually made contact, again, it's almost 2 out of 3 that have either completed or they're currently compliant with their treatment, and about 1/3 did not complete. Some demographics of our, and this was based on the sample we took early on of 101 people, but the average age is about 35 years old, 68% male, 32% female, 82% white, 15% African American, 3% other. And then we kind of compared that to some overdose demographics in the department, and it was very similar. We don't have the age number for whatever reason. I just got a placeholder in there for that, but the demographics are pretty similar. I referenced some preliminary findings from the UW and from Dr. Zagurska's, our evaluation team. For those of you here are probably very familiar with the ASAM and the Brief Addiction Monitor. That's where these scales come from. But here's some of the things we've kind of seen in some early analysis. One, MARI completers and non-completers had similar pre-treatment scores, but MARI completers reported significantly improved scores post-treatment on the PHQ-9 depression scale. On the GAD-7 anxiety scale, MARI non-completers reported significantly higher pre-treatment anxiety scores than completers. Completers reported significantly improved anxiety post-treatment scores. And on the drug protection factor scores, MARI non-completers were initially significantly higher on the drug protection scale than completers, but the completers reported significantly improved drug protection scores post-treatment. This is for drug risk, drug usage, similar. The other thing I want to point out that we're also looking at is we're looking at MPD arrest and contact data for all MARI referrals, so that whole group of 264. We're looking at contacts with the Madison Police Department and arrest 12 months before their referral date and 12 months after, so we're looking at a 24-month window there. We also created a historical comparison group of the sample size is 57 that was pulled from MPD data overdoses from September 2015 to August 2016. And these would have been people that would have been eligible for MARI had MARI existed at that point in time. But we're using that historical comparison group. And one of the things we saw so far that MARI completers had significantly fewer post-treatment arrest in the 6-month period following completion of MARI when compared to our historical comparison group. That, in short, is just some very early preliminary signs that we believe MARI is, it's not working for everybody, but it's definitely working for some. And it looks like it's working for people that came in that had low to moderate risk in their initial ASAM and BAM scores. But the other thing we're hearing from the recovery coaches and from Kim at Connections Counseling is the fact that, and it would kind of make sense, is that we're also seeing these folks have fewer involvements with the Madison Police Department, or the other piece of data I forgot to tell you that we're looking at is number of days in jail, the Dane County Jail for the 12 months before and the 12 months after. So consequently, that would make sense. And what we're finding is that the idea that this citation or possible trip to court is hanging over them has been great leverage, according to the recovery coaches and to Kim at Connections Counseling, to keep them engaged and committed to the initial 6 months of their recovery. So with that, I know I went really fast. This is a graphic or just of our team, our MARI operations team, we call it. Or throughout the course of the project, this team met monthly on the second Thursday of every month. And then on Thursday mornings, I had a team that was just the people that were authorized on the release of information. Myself, Christine Taylor, Bernie from the police department, and Kim. We would have a meeting every Thursday morning where we would, usually Kim carried a caseload of anywhere from 20 to 30 MARI participants at any time. And we basically would talk who's doing well, who's not doing so well, who should probably be terminated because they're not engaged anymore or what have you. And just kind of do kind of a case management type meeting. It usually lasted about an hour every Thursday morning. So I'm going to pause there, Wes. I know I talked about a lot, but I'm interested in anybody's reaction or questions about what we're doing. And I kind of skipped over, I talked a little bit about this, but this slide is just the new Pathways to Recovery grant that's going on now. And there's a new MARI forum, Dane County Human Services down at Tellurian, 2914 Industrial Drive, the Detox Center, Treatment Readiness Center. That's where the assessments are being done there. Connections Counseling is no longer doing assessments, but Dane County is taking that over, but they're also doing self-referrals. We've got a safe station concept. There's been a paramedic that's been hired for the fire department that's being trained in addiction. That's going to be paired with an addiction resource officer from MPD. So a lot of neat things happening here. There'll be more information coming for that in the months and years ahead. But I just wanted to most importantly share with you today and my great honor of being part of the initial 3-year part of MARI. And I'm working with Dr. Zagurska now basically to wrap up our final analysis. And by April of next spring, we have to submit our final report to the Justice Department. And we're already starting to write some articles for some research journals based on the data on this initial MARI project. There you go, Wes.
Great. Thank you, Joe. I do have a couple questions that have come in here. The first question that we have is from Kira, and she asks if they do commit another offense in those 6 months while also in the program, what happens?
That's a great question. We look at all of them differently, and it depends upon what the offense is. If it's another overdose, and we've had a couple of them, doesn't mean that they necessarily get tossed out of MARI. We try to meet them where they're at and try to work with them. I'm happy to say that not a lot of people had further arrest or contacts with the police post this, but some did. As that slide I spoke to earlier, I mean, we lost 6 people through overdose fatalities, and a couple, 3 of them I know were people that just simply had been referred, but they didn't contact and follow through with their assessment. And then one was a completer that actually completed 6 months of MARI and then later overdosed and died. And one was in the middle of their MARI treatment.
Great, thanks for answering that question for us. The next question that came in is, can you explain a little more about how the education on addiction helped change attitudes about those seeking recovery?
Yeah, I presume you're talking about the education, the training for the officers?
Maybe Mary, if you'd want to chime in on.
Yeah, Joe, this is Mary. Yeah, I just thought it would be good for the group to hear a little bit more about, right, how the education for the officers, and I know you've talked about this in the past, but really, understanding, the disease of addiction and how it maybe changed, attitudes, toward the recovery community, or for those, who needed help with their opioid use disorder, with their problems versus, having, focusing more on the, arrest portion of it. So yeah, just really the education on addiction.
Yeah, that's a good point, Mary. Police departments are pretty, 5 years ago, we're pretty unknowledgeable about addiction. And I can speak to that because I was still in a police department in 2014, 2015, when we were all getting equipped to and trained in how to administer Narcan and naloxone. That it's one thing to be trained to administer Narcan to an apparent overdose subject. It's a completely another thing to have some understanding and comprehension of what opioids do to the brain and the disease of addiction. And I really felt that through the in-service that the MPD put together in the spring of 2017 and trying to create some greater awareness around addiction for officers was really important part of our implementation of MARI. One of the things in hindsight that I think we need to do a better job of is that has to be an ongoing training. There's been a lot of turnover in the Madison Police Department, and I think it's something that I would encourage all police departments to commit to at least annually, to having some type of training around addiction and a better understanding of addiction, because it's creating that culture and mindset that you can not only save a life through the administration of Narcan, but you can actually change a life through understanding a program like MARI and making referrals as an officer when appropriate, when the criminality root cause is the disease of addiction. I hope that answered the question, Mary.
Yes, thank you so much. Very important.
I've got a question for you, Joe. So I guess for me, and I've in my past of the line of work that I do too, I've approached my local, community police departments and trying to advocate for recovery and educate police departments on how they can support recovery efforts. So maybe from your perspective, being on the side of the police department, and maybe this could be something you share about your experience of when this all started, how would you recommend, or maybe some things that you would recommend to an individual who wants to approach their police department to see if they're willing to support recovery efforts if they haven't yet already, so say an individual that's in recovery, what do those conversations look like? And I don't know if you've gotten this question before or people have reached out to say, how do I connect with my local police department to see if they're even open to supporting a similar program?
That's a great question, Wes. Let me explain how the Madison Police Department ended up implementing MARI, and I think it was really predicated on some groundwork we had covered in the years preceding MARI around restorative justice. And when I came into MARI in spring of 2017, my last couple of years in the Madison Police Department, I helped work with Dane County to create the first restorative justice court in South Madison for 17 to 25-year-olds for misdemeanor crimes, where rather than arrest somebody, take them to jail, and send them to circuit court with a CCAP record for some frickin' misdemeanor, how can we at the community level get peacemakers trained and be able to repair the harm caused by that act at the community level? And I would say that the conversation that I would suggest is that you have to kind of start there with thinking more of a mindset that you don't have to be dependent on the traditional criminal justice system to solve problems. police departments, particularly traditional police departments and traditional police chiefs, to want their officers just to make arrest, do their job, take people to jail, send filings to the district attorney's office, to the city attorney's office, and that's who has the discretion to decide whether or not to charge or not. Okay? What we're seeing is a movement where police departments aren't even dealing with that step because, quite frankly, we know our district attorney's offices are already overwhelmed and underfunded just dealing with the felony caseloads that they got, for God's sakes. Here we're dealing with a true public health crisis, and we would encourage chiefs to think outside the box and figure out how can we figure out a way to deal with this and not use the traditional criminal justice system where we're really dealing with a disease, and that disease is addiction.
Yeah, and I just hearing you talking, I can hear the passion in what you're saying and what you're believing, and I think that's amazing that this program has been there, that you've been there to help this program, and all of the partners that are helping this program as well. I think it's awesome. I don't personally live in Madison. I live in a small rural community where I've engaged the police departments and I've had different experiences and how they support recovery and how they don't. But so that was just kind of course, a question from me, and I'm sure other people out there too may be struggling in the same ways of how to engage law enforcement to support recovery and give individuals chances at recovery rather than what you said of just giving them tickets and locking them up. So I appreciate you answering that and everything that you've shared today. I know that we're over time a little bit. I appreciate everything that you've brought today. I just want to open this up now. If there's anybody else that has any questions for Joe before we part ways today, now's the time. Or any comments too, if anybody has any comments.
Wes, I'd just like to give a shout out to the Madison Police Department, and I'm very blessed and fortunate to have spent 3 decades of my life from a young kid out of Platteville at 22 years old that was influenced by a great police chief in David Cooper to the ideas of the Madison Police Department and some very progressive thinking about how we police our communities. And policing is much more than just arrest. And it is that background and my involvement with this department that is still very progressive. It continues to be, and it will be into the future. And to be part of a project like MARI, ironically, after my retirement, it's still one of the greatest things that I've been fortunate to be involved in all my years of public service. So I want to thank you, Wes, and Wisconsin Voices for Recovery for the work you're doing. My family's been affected by, we lost a loved one in 2015 to an overdose in the Tempe area out in Arizona. It's very personal for many, many people. And I really appreciate the work that you guys are do and continue to do.
No, and I'm sure I can talk for our team here too. We appreciate you spending some time with us today. I know that you've done some presentations for us, and you were a part of our rally over the weekend, which was awesome. So we just thank you. I see some comments coming in and just saying thank you, Joe, for everything that you've been able to do. Even though you're in retirement, it sounds like you're still pretty busy. So keep up the good work. And if there's anything too that we could do on our end, let us know.
You bet. You bet. Thanks, everybody.
Thank you so much, Joe. You take care.
You bet.